o'clock. I'm going to call the Health and Human Services Committee meeting to order. Today is Tuesday, July 8th, 2025, and let's stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I don't believe there's any public comment, so we will move on to number 4, approval of June 4th, 2025 Health and Human Services Committee meeting minutes. Do I have a motion? Oh, so moved. Second. Any questions? All in favor? Say aye. Aye. Opposed? Okay. Moving on to number 5, operational functions required by statute, ordinance, resolution, or policy. 5A, discussion and possible action by HHSC. Number 1, discussion regarding 2026 annual budget development and policy recommendations from the committee, including review of the mandatory discretionary program document and discussion of rates and fees. And perfect timing.
Sorry about that. My delayed. My clock had the wrong time on it. It was 5 minutes slow. This is I thank you, Madam Chair. This is going to be a standing item on your agenda for the rest of the budget cycle. I know HR Finance and Property Committee Chair Robinson just also walked in, but he can tee it up in terms of our process. But the short explanation, and I'll follow up after John, is that this is very similar to the process we used in previous years. The guiding principles, again, are to give the county board and all the standing committees more opportunities, both early and throughout the process, to really provide guidance to administration as we build the budget, working with department heads. And again, it's going to focus on the 3 questions that really get at the role of the board relative to providing policy direction. That is, what programs or services do we offer within the rules of that are provided to us by the state legislature? At what level do we provide those services and programs? And then lastly, at what cost? So with that, I'll kick it to Chair Robinson, Committee Chair Robinson, and then we'll circle back and talk through the mandatory discretionary program document and give you an outline of the fee appendix.
And thank you. I was late because his clock was late, so. So we are continuing to try to build upon the process of engaging the county board and its members earlier and more often in the development of the budget. And we started that a couple of years ago in response to concerns that were raised by county board members relative to their ability to impact it. So we're starting at the committee level and encourage all county board members to raise issues at the appropriate standing committee where the committee has jurisdiction for certain departments, whether it be social services, health, or North Central Healthcare, or others in the development of the budget. But what we encourage you to do is look at it. There's, for lack of a better term, there are 2 budgets. There is the administrator's budget that he prepares and he presents to us in September, at which time it no longer becomes the administrator's budget, it becomes the county board's budget. And that is the one that we will act upon and set the priorities. And so there are 2 opportunities for you to have input into that. One is into the development of that administrator's budget between now and September, and look through the programs that are under your purview. What are the priorities? Are there new programs that you want? Understanding that there are limited resources, so if you've got a new program, we need to more than likely look at where will we pay for that, or how will we pay for that, and are there opportunities to gather that through fees or cuts to other programs. And then once the administrator introduces it, it will then be presented to the board, and the HR Finance Committee will look at it, but ultimately the decision is up to this county board to make the final determination of what is and is not included in that budget. So from October through the middle of November, the board will really be looking at what's in that budget. Again, I encourage you to look at the areas that the administrator has outlined. And if you've got interest in areas outside of this committee, please contact, follow those other committees and engage them in that process or bring it to the HR Finance Committee. But we really want individual members engaged, again, early and often. Several things to remember is, we're still in the process of understanding how the state and the federal budgets will impact us. We now have a little bit more certainty as to what's in those documents, although there's still some uncertainty in how some of those rollouts relative to Medicaid administration and other things will impact us. But we will continue to change the policy, the budget as we learn. Typically what happens in the area of general transportation aid, our highway aids, is we'll get an early estimate, then we'll get a revised estimate right before the budget's approved. In the past, the county board always cut that, and then couldn't understand why the highway aids would decrease the next time, because it's a 6-year average, and if you're cutting to equalize it, you're cutting your base, and your portion relative to other counties goes down and theirs goes up, and we lose highway aids. So not all dollars are the same. And it's important that you look at how those dollars are generated, whether there's a 6-year average in the case of transportation, whether there are match requirements, and other things. You may cut a program thinking that it's 100% levy. Well, we've got a $200 million budget. We've got a $55 million levy. So $145 million comes from other sources that we need to be, keep in mind when we begin to look at it and factor in how a cut might or might not affect us. And reserves are one-time money. Once we spend them, they're gone. We're trying to work on the working capital and reserve policy and trying to present that, trying to finalize that this month, so you have a good understanding of what's restricted, what's not, where are we flexible in spending, what we need for cash flow purposes and other things, and we want to share that with the board early, again, so you've got the understanding of how those impact us going forward. But again, I encourage you to, if you've got ideas, float them. One of the other things, take a look at the fees, because as our costs go up, if our fees don't go up, we need to pay for those programs and services through some funding source. And if we haven't increased our fees, we can't always look to general purpose, shared revenue or sales tax, because those are limited going forward. So it in essence amounts to a cut. So if our costs go up, we need to look at trying to capture those costs. I know the health department historically has done a very good job of having those fees relate to the actual cost of providing those services, and it's a good example of a program that's been more proactive historically in doing that. So, Administrator Leonard?
Sure, thank you. Just building off of what Chair Robinson said, the standing committee responsibility at this point, please be inquisitive and ask questions. So the mandatory and discretionary program overview document starts on page 20 of your packet. We've really only made very, very minor changes from last year, so it's largely consistent. So again, that document is an overview. It tries to highlight the large programs or services that we offer, and particularly highlight the things that we're required to provide. You have oversight over a number of departments. Many of them are here today. To be able to, if you have a question, we're here to try to answer it. We much prefer the opportunity for an open book take-home exam as opposed to a pop quiz. So if you have a question you're going to have, please let us know in advance, and we'll try to be as prepared as we can be. But we'll still, if a question occurs to you during a meeting, don't hesitate to ask. But each of those departments are here to have that conversation. A little bit of kind of background where we are in the process. As Chair Robinson referenced, one of the things that HR Finance is going to be taking up tomorrow is the discussion of underlying budget assumptions and budget priorities. So in terms of budget assumptions, one that I think all county committees certainly have interest in, I say it, I've said it frequently throughout the budget development, but also anytime I have the opportunity to talk about our staff, they're extremely valuable. We deliver services. Governments deliver services to residents and guests. We need really good people to do that. We're in the process of working with our consultant to take another look at our compensation plan, and I know updates are coming. The data we used to build our compensation grid was from early 2022 data, and we haven't moved a scale from 2022 through present. Well, if you think about the market, the labor market during those years, it's very similar to the home market. Some pretty substantial increases relative to inflationary pressures on wages. We're going to need to, my recommendation is going to be, we need to make some changes relative to that scale, why is that important? It lends itself very well once you have the discussion about mandated services and you have the discussion about level of service. The last question again is at what cost? And HR Finance and Property Committee Chair Robinson hit the nail on the head. If we're delivering services that have the opportunity for us to charge fees, that is, they benefit a particular individual or they're for a particular service that's non-mandated, great opportunity for, or even when they are mandated to some degree, great opportunity for cost recovery. Because if you're not going to increase your cost by the increased cost for us to deliver the service, you are effectively subsidizing that service with tax levy, because as Chair Robinson referenced, we have limited tax levy. So just an example, I think it was earlier this month, the Environmental Resources Committee had a great discussion about our personal on-site wastewater treatment program. We have a monitoring component to that program, right? If you get a new POUT system, new personal on-site wastewater treatment system, we have fees that correspond to the installation of those new systems. But just as important as the installation of that system is the maintenance of that system, right? It's the essence of the program, right? It doesn't do any good to put in a system and not make sure it continues to function appropriately. Well, we haven't been charging a fee. A significant number of counties throughout the state have implemented a fee, and a number of those fully fund that maintenance program with those fees. The thought process, the discussion at Environmental Resources was very good because it hit on a lot of the things I just alluded to. That is a program, it's mandated, but it serves a particular user group, right? If you live in a home that's hooked up to a municipal service, you pay through your municipal wastewater system to get for the wastewater service, for the water service. But if you live in a more rural setting, you're on a well and have a mountain system perhaps, you're not on those systems, so you have to install the system. And then there's the maintenance program, which we are mandated to oversee. So that was a great conversation about whether or not to implement one of those user fees. Ultimately, they recommended to move forward with that user fee, which staff are going to bring back additional information on that process. But I just bring that up as illustration. Chair Robinson referenced the health department. Another great place to talk about fees. I think it's an area of the budget where the county board and staff have done very well to enhance transparency recently. So beginning on page 3 of your packet are a subset of pages labeled Appendix A, Rates and Fees. This was incorporated in your budget. Historically, it had not been, but over the last 2 years, staff have worked to put in place this rates and fee schedule so that you can see the rates and fees that we are charging for the various programs and services that we offer. Again, some of these areas we don't have flexibility. Some of the court fees, of course, are set by state statute. But helpful for you to see, and I think it's very transparent to have it formally adopted as part of the budget, because at its core, that's a county board function. Setting the fees. At what cost do you want us to deliver the services? That is your area, that's your prerogative as an elected body. That said, it drives the budget. We can't have a budget that presumes revenues that never come because the fee schedule is not accurate. So again, those are the areas we're looking for guidance. If you have questions, what programs or services do we deliver? Now, what level. So I always try to describe the question of what level. Really, that's a quality measure. That can be something as like timeliness. If it's taking us 10 days to review a permit and that you want to cut the service level to save, see if that could save staff time. I mean, we could do it with less people. It's going to take longer. It's a discussion you can have. Or you want us to do it faster. It can be something, another example of quality measures relates to highways. An easy example to understand. The county board has picked a pavement rating, a quality rating of 7. We want our roads to have an average pavement rating of 7. Great direction from the board, then staff build our plan and our budget around that. And the last one is the fees. So not to belabor the discussion, but if you have programs or services you want to discuss, and I know Supervisor Cavelli previously brought up wanting to talk about, the county board had some discussion around homelessness and what that might look like as a new area for the county to be involved in relative to project management. Certainly something we can do. The last thing I wanted to bring up, as Chair Robinson referenced, North Central Healthcare falls under the purview of this body to receive reports and information, and this body can give direction. That said, there is an independent body that governs North Central Healthcare by virtue of state statute in our intergovernmental agreement. It's actually 2 bodies. One is the North Central Program Board, North Central Community Services Program Board, but also the North Central Healthcare Executive Committee. I have the privilege of serving on both, and a number of years ago, consistent with direction from the county board, those bodies challenged North Central Healthcare leadership with identifying areas where we were delivering services that were non-mandated and where there was another private sector entity that could take over those services. And I would give a lot of credit to staff at North Central for some of that work. Recently, our vocational training program, we had some staff turnover within that program at North Central, and working very closely with a nonprofit provider, Aligned Employment. That program has been transitioned to that non-mandated program has been transitioned to that, all the clients have been transitioned to that private provider. Why is that important? Well, the good news, services will continue to be delivered. And at this point, at least our budget was that we were projecting a net loss moving forward about $50,000 in 2024 was our net loss. And that continued through May. So year-to-date loss of about $14,000. It's going to take a lot of those sort of decisions, finding out where the opportunities are to continue to balance the budget in light of levy limits and other challenges. But just wanted to report that, again, a great opportunity. Where is there a private sector provider where we can make that transition? The private sector provider wants that work. And where it won't negatively impact residents. So that's all I had, Madam Chair, and happy to answer any questions. I know you're going to get another presentation from Krista about one of our programs that the county board has a lot of interest in historically, or I should say one of our strategies to deliver services, which is the Family Keys work that we do. But that's all I had.
Any questions for Administrator Leonard or John Robinson? Thank you.
You guys hear me?
Yeah, I just wondering, like, under the health department, it just seemed like some of them fees, like, went from like 370 down to 11, or that's the projected, under the retail food service meals health department. I was just wondering what, just why is there such a big difference there?
I take it you're talking on page 8.
Yeah, page 8.
I don't know, Amanda, it's up on the screen. We can look at the fees. I know we did a comprehensive review of our retail food and licensing programs.
is such a big difference.
So a lot of consideration was given to right size, how big the vendor was, along with the complexity of the inspection needed at the time. So it went from a more broad rate for people down to what was required at the time of inspection for the license to be issued. So that's why the reduction happened in that instance. Prepackaged food doesn't need as much as what someone who's, cooking at a full-scale restaurant would need.
Okay, thank you. I knew there was probably a good explanation, but it just was such a big gap, so thank you.
Any other questions? Seeing none, we will move on.
Madam Chair, if I can, I think this was the section where if Supervisor Cavelli, if you wanted to discuss some of the takeaways from the homeless task force relative to 2026 budget development, I think this would be the place to do that.
Sure, and I wasn't sure because you already mentioned it, that wanted to take a look at what the county's role is moving forward with the resolution to have Administrator Leonard work with the city on the homelessness situation and what that program looks like moving forward. Going into 2026, I believe first quarter, we're looking at having a plan outline for that program. And then also, what kind of funding that we would need to support that program and where it would come from.
And I have had, if I may, Madam Chair, just to follow up, certainly the task force, one of the things that they, at the joint meeting with the city council and the county board, one of the things that task force co-chair Cavelli referenced was this idea of the strategic plan that city and county staff would lay out that really clarified what is the goal, or what is the responsibility, I should say, of the city and the county, and where do we see the nonprofit or other sectors playing more of a role. And really the big takeaway, this is from my perspective, and it was certainly the task force recommendation, is to mirror some of the work from the city and county of La Crosse. And one of the things I've been evaluating with Amanda from the health department is what might that project management role or position look like, and what are the opportunities, where might it best live? And right now, my working hypothesis is realigning resources within the health department to have that project management role fall within those within that department's responsibility. And I think credit to Amanda and her team. I think we have some opportunities to make sure we align fees and program activities of staff to various funding sources, where my goal is going to be to strive to do that without any additional levy. I can't promise that that's going to be where it shakes out, but that's kind of the working hypothesis right now. And I assume that's the direction of this committee, that you'd like us to bring forward a proposal for, having the county step into that project management role, the city take the role of kind of that street outreach and engagement, which they currently have been doing, the work that Tracy Durante has been doing. So that's kind of where we've been working on right now. I want to, if I'm off base on that, please let me know. But that La Crosse model and finding out how we might do that here with existing resources is kind of where my mindset is right now.
And I think that you're right on track. After having discussions with Chief Barnes, have you been able to touch base with Chief Barnes on the RFP and everything else that's going on?
Yeah, certainly. I actually just talked to him earlier today. The city is going to be taking up that RFP for emergency shelter services. And again, the county gave me what I thought was pretty clear direction, that long-term, the county doesn't see a role in either directly providing or funding emergency shelter services on a long-term basis. But you did, of course, allocate funding this calendar year through your contingency fund to partner with the city on that. But close working relationship with Matt to this point. I've actually had the opportunity to volunteer I toured the shelter before it was operational and spoke with staff, but actually had the opportunity to volunteer recently one evening, and I'm going to be reaching out to the county board, and I hope you all take advantage of, I'll give you a couple dates when I work with Tracy where they need volunteers. It was an eye-opening experience to kind of see the spectrum of individuals and some of the challenges that they have, and I think it might help you in your work as policymakers to say, hey, is this something that the county sees a role in addressing? So more to come on that, but I do have a list of volunteer dates that I'll circulate to the county board. Just wanted to make you aware of that, but yes, certainly working closely with the city, and we'll see what the city council does with considering the proposal it received. Again, the county funding that you pledged was really just through 2025. And Matt and the mayor, I think, are very understanding of that. I spoke with them again about that with Matt today, making very clear, like, again, I don't pledge funds, the county board does that. I move to carry out your will, so hope that helps.
Thank you.
Are there any other questions? Yes.
In regards to the homeless task force and what we have going on, just to keep everybody in the loop as well, the VA is going to be hosting a surge event here in Marathon County, Portage County, Wood County for unhoused veterans. I have the dates for that and the information. If I could get emails, I can send that out. They're looking to work with local organizations and local representatives that work specifically with that, so we can have targeted efforts, know where VA employees and those people that are able to get those WIDA or those housing vouchers into an area. And then they're also going to work towards, or they're trying to do, if there's any veterans who are unhoused who are willing to relocate to Monroe County, La Crosse County, where they have active vouchers available, that they're willing to help make that process happen to get them somewhere and get them housed. So that's just an update as of yesterday. I'll get that information out, and that's the goal. They're having teams for each county go out and working with CVSOs to try to figure out what we can do. I just got an email this morning. We have about 6 unhoused veterans who are currently incarcerated, and once they leave incarceration, they will not have anywhere to go. Some of them, we don't have verification of veteran status, so that's a struggle we run into right now. But we will have some here in the near future.
Thank you. Any other questions? Okay, we'll move on to 5B, discussion and possible action by HHSC to forward to County Board. 1, consideration of a resolution supporting legislative action for volunteer driver insurance.
Madam Chair, I'll take that. I'm Lori Muskimmons. I'm with Conservation Planning and Zoning. I've also brought Jenny McKenzie here today with me from North Central Healthcare. And on page 69 of your packet, there's a resolution from the Transportation Coordinating Committee that we're a part of, that they moved forward to Health and Human Services for consideration related to supporting legislative changes for insurance for volunteer drivers. When we were working with the Transportation Coordinating Committee over the last couple years on our locally coordinated public transit human services plan, one of the issues we identified was the ability to recruit and retain volunteer drivers. And part of the challenges with recruiting and retaining them centered around volunteer driver insurance. So many of our residents, elderly and people with disabilities, rely on volunteer drivers to get essential transportation services within our county. But what's happening within the state of Wisconsin is these volunteer drivers who come forward to drive people to these critical appointments are actually being classified as commercial drivers, similar to that of Uber or DoorDash, and they're facing premium increases of hundreds of dollars more every year. So that's leading to people choosing to not volunteer drive anymore. So in working with some groups within the state, we identified one thing we could do was put forth a resolution to the governor and to the state legislature to encourage them to do something like what Minnesota has done, which would create provisions so that volunteer drivers could not be charged commercial rates to be a volunteer driver and serve nonprofits, North Central Healthcare, things like that. So what we're at now is we have drafted a resolution that passed through the Transportation Coordinating Committee in June, and now it's before Health and Human Services to be considered to be moved to county board. But it also, like Jenny McKenzie, because she runs transportation services at North Central Healthcare, to tell you specifically about some of the impacts they're seeing to their volunteer driver base because of these insurance premiums.
Thank you all for having me. I've been with North Central Healthcare since 2002, running the transportation program in some capacity. When I started this job, we took all of the elderly and DD transportation for Marathon County and put it under one roof. Commission on Aging, Social Services, we all fell under the North Central Healthcare group. During the course of my tenure here, I have recruited hundreds of volunteers over 23 years. And prior to COVID, which was like, that was our biggest time that we had volunteer drivers. We had anywhere from 35 to 40 drivers all around Marathon County. As of right now, I have 5 drivers that drive on a regular basis, and by regular basis, that's probably 2 or 3 times a week, and another 3 drivers that drive once a month. So we went from 35 to 40 drivers to, 5 point, whatever. So we definitely have scaled down our services that we can provide only because we don't have the volunteers to do it. An example of this is a couple months ago, I had a client from Colby who goes to dialysis in Medford. They are a Marathon County resident. They are ambulatory. I had to turn them away because financially it doesn't make sense to send a paratransit vehicle out there to pick them up, take them to Medford, stay and wait with them because it doesn't make sense to come all the way back to Wausau to do 1 or 2 trips. So it's a very expensive trip. I had to say, no, I'm sorry, I couldn't help you. They were an ambulatory person, and if I had a volunteer in that area that I could get to take this ride, I would have, but I don't. It's getting really tough, and I really appreciate the Transportation Coordinating Committee in producing this resolution, and I hope that you all sign on to it and the county board, and we can get it down to Madison so that our representatives can do something about getting volunteer drivers to be able to just pay regular insurance instead of commercial insurance. They're not Uber and Lyft drivers, they're volunteers.
Thank you.
Thank you.
Any questions? Okay, what are your wishes?
I'd like to make a motion to approve the resolution supporting legislative action to protect volunteer drivers from unfair insurance practices.
I'll second that.
We have a motion and a second. Any questions? Those in favor?
Aye.
Opposed? Okay, it's unanimous. We'll move that forward to the county board. All right, number 6, educational presentation and committee discussion. A, Social Services Department Family Keys Pilot Program Update and Outcome Review. Take it away, wherever you want to be.
Yeah, Krista can come up here. She can drive the PowerPoint then. I already brought this up before. This is again a initiative that the county board authorized our participation in by receiving grant funds. Bottom line up front, this has worked very well from a programmatic standpoint, but also from if you cared about nothing else, financial standpoint, this is a very successful program in terms of the outcomes and cost savings. So moving forward, again, bottom line up front for the 2026 budget, really this is a strategy. I mean, we've called it a program, but it's a strategy. It's a tool in the toolbox that we use to address out-of-home placements and mitigate the need to have out-of-home placements. So we're going to build this into our standard out-of-home placement budget line within social services. But all that being said, really appreciate Krista being here to walk through what I think from a programmatic standpoint and outcome standpoint for people, it's very successful, but also from a financial standpoint, I think the state should be very thrilled with the outcomes they've had across the 3 counties. I know I'm partial, but I think ours is the best.
Well, good afternoon, Lance. To really share, excuse me, the full year of 23 and 24. We don't have 25 in there currently, but I can share a little bit with you about where we're currently at. So we'll start with just talking about the number of families that this program has been able to serve. You all know about the background, so I won't go down that rabbit hole with you all. But in 23 and 24, we were able to serve 21 families, which was 53 children. And so that means that number of children were engaged in the child welfare system where housing was unstable, and one of the primary reasons that they were either already had been removed and we were working on reunification, or that we were preventing their removal and placement and out-of-home care for. So of those families, reality is not every family did successfully complete Family Keys. There is a lot of program components, as we talked about in the past. There's a handbook that they must follow. They must save 30% of their income. They must allow us into their home every week. There's a lot of different rules and guidelines to follow to make sure that our children stay safe and that this program is really sustainable moving forward. And so when we looked at what is our definition of successful versus being unsuccessfully discharged, successful is that they had stable housing upon completion of the program and they were able to maintain placement of children in their care. So of the families that we served, those 21 families, we have 38% that discharged unsuccessfully according to our definition and 62% that discharged successfully. So 13 families discharged successfully out of those 21. When we look at where those cases came from, they are primarily coming from Child Protective Services, but we have had some come from Youth Justice. So youth might have been placed in out-of-home care and we were unable to reunify because their parent no longer had housing. We did enroll them in the Family Keys program in order to successfully reunify that child from foster care. So when we looked at the program, we not only wanted to look at how many people discharged successfully and what those definitions are, but what else does that mean? We wanted to look at additional Child Protective Services reports coming in. Is there a difference from those families who successfully discharged from this strategy versus those who did not? And what we found is there is not. There's not really a very big difference in the number of additional reports that are received. So these are post their discharge from Family Keys. Did we receive another report? And was that report screened in, meaning we completed an assessment? Or was it screened out, meaning that it didn't rise to the level that the state set for us to do an assessment? So as you can see on these pie charts, it's fairly similar. Even having a few more screened in reports, one more, I suppose, than our unsuccessful discharged families, excuse me. So of the successful families, those 13, then what we wanted to look at was, were they able to maintain their housing after they were successfully discharged, and were they able to maintain employment? Right? It's great that they were successful during the time that we served them, that we saw them on a weekly or monthly basis, that they had a lot of support, but what happened afterwards? Because a lot of this strategy was to create that sustainability so we didn't have to become involved, hopefully, again in the future through child welfare. So of those who successfully discharged, we know that 77% were able to maintain their housing post-discharge as of a few months ago when we reached back out to everybody to check. So some may have been discharged over a year ago, some may have been discharged 4 or 5 months ago, but overall, we know that 77% were able to maintain their housing. There's 3 that we don't know because they didn't respond to our outreaches. 2 didn't respond to our outreach, and 1 is now living in Puerto Rico. So But that's great numbers, right? That those families maintain housing. I did look at those 3 that were unknown, or at least the 2 who didn't respond to us, to see, did we receive a subsequent Child Protective Services report concerning housing being a safety concern? And we did not. So, as I said, we also wanted to look at their employment or their stable income for those who successfully discharged from this program, and the numbers are exactly the same. 77% were able to maintain their income, and the 3 were not sure. Again, I did check CPS reports to see if that was a reason for receiving another CPS report on the unknown families, that they weren't able to meet their youth basic needs, and that was not a reason for an additional CPS report. The other thing that we know and we wanted to take a look at is, so that's great, but we know that all of the families who entered Family Keys didn't have housing to begin with, right? So that's basically like 100% success were housed. But employment is different. Some might have been employed beforehand, some might not have been, some might have had really inconsistent employment. So I wanted to take a look and say, like, okay, so we have 77 who maintained it, but what did that look like before? So of those 13 successful discharges, at the onset of the Family Keys referral, 6 of them had employment at that time. So that's a pretty big increase from only having 6 to going to 13, at least, maintaining that stable income and employment. Okay, so data is nice, and we all like that, and we'll get to the numbers, which we all like even more. But we want to make sure that we share, too, that this is a much bigger impact than just what the data says about housing and employment and the numbers, right? This is important work that we do, and when we reached out to families to obtain some of those outcomes that we just talked about, we asked them if they had anything that they wanted to share with us about their experience with Family Keys. And on this slide are just a few things that some of the individuals who participated or families who participated had to say. They saved my life, my kid's life. It was very successful for us. I think that the program is great. I went through a lot of different resources, and Family Keys is the one that was very successful. I have nothing but good things to say about Family Keys. Everything went well. It was a fast process. They immediately started getting things going when I was accepted. I had a home a week later. I was able to move in right away. They helped me financially to build a nice amount of savings. I was in the program for about 4 months until I transitioned. So some of the things they had to say. Some of the other things I think for us are individuals having a bank account for the very first time, having credit scores substantially increase, having individuals sign their very first lease and understand what it means to be a renter, to pay their bills, and not to mention probably the most important, right, family preservation or reunification, having children be able to be with their families. So as you, I believe, are aware, part of this strategy was to put together a series of films that really talked about the impact of this program, and I want to share one of those with you today. The other thing we haven't really talked about is how this has built and maintained our community partnerships, how we're able to really tell families that we are here for them, we are here to set them up for success, and there is something tangible that we can do to help get them into a better situation. And I think that this film, It Takes a Village, if this will go, I'm going to not go to it, I'm going to click this one in. I think that this film does a nice job of sort of demonstrating that. Pull it in bed. Sorry, I'm going to scroll here for a second. All right. Plug this guy in. It should be embedded through here. I think it did too. We'll see.
Bear with us, technical challenges.
All right, here we go. I think we're tuned up. Keys has been impactful in more than a fiscal manner. It's also brought together our partners. As social workers, we are not experts in housing, and so we've had to collaborate with our housing partners, our law enforcement partners, our policymaking partners in ways that maybe we haven't explored historically.
It's a resource that works because we don't want children separated from their parents. Nobody loves a child the same way their mom and dad do.
It's your first TV time.
When you're trying to get your life in order and every door is slammed in your face, it makes it extremely hard to recover, to put your family back together, do the things that need to be done.
When we see things that work, that make the community safer, that's better for kids, and it saves money, and that money can be used and reallocated in different ways to do more for the community, that's just common sense.
It's really hard to go to work every day and live in your car, or where are you gonna shower? Where are you gonna get your son to go to sleep at a decent time and eat,
I like Family Keys because it's helping to bridge that gap, and as the years go by, we make better and better relationships with landlords in the county, and they get more familiar with the program, and then they say, okay, well, they've got this charge, but they've been working with Family Keys, and I know what that is.
Either they have evictions or maybe they aren't working, low credit scores. So this kind of bridges that gap where we get families connected to the landlords. Then these families can show the landlords like, hey, I can take care of a property, I can pay the rent. Because when you've had the history that I have, landlords don't want to rent to you. I have a drug conviction. Nobody wants to rent to you.
What sold me on the concept of Family Keys was accountability. It's a transitional program that gives people the skills necessary to be successful moving forward. To break the cycle is cheaper than foster care.
I think what's unique about Family Keys is, yes, it attacks the housing, but also it attacks the issue of kids being removed from their home. If kids are removed, there's costs that are being passed on to the county. We know that it's more expensive for a community to take care of or treat somebody who's unsheltered or homeless than we do to house them. Not only is it better for families and better for kids, but it also is better for the bottom line. And you need a mix of both to make things sustainable. And that's kind of another strong element that Family Keys provided.
One of the things that I think has allowed this to be successful is the partnerships that we enjoy here. We all are involved and invested, and that partnership, I think, is key to any successful endeavor where we're trying to help people.
We have a local nonprofit that when we pitched Family Keys and all the resources that were going to be available and how we were able to craft what we needed locally, this local nonprofit stepped up and purchased a home specifically for Family Keys use. We were able to work with another partner who within a couple days had multiple volunteers who came over and put in some sweat equity and cleaned the house out for us. And then within a couple months after some fixing things up, we had our first family place. And it was really neat to see, our state, our local human services, and then all our partners locally to really just come together, wrap around, be creative, and really make something special.
Social services can't do this work alone, and we shouldn't do this work alone. And we need our community partners to come to the table to understand what our families' needs are so that families can have accessible services outside of being mandated. All right. Well, I hope you enjoyed that video. I think it really does a nice job of highlighting the importance of stable housing, the importance of our partnerships in the community. and how this strategy here has brought our community more awareness. This is not social services doing this work alone, and I think that's probably the most exciting, gives me goosies part about this strategy, is that that's what's important, our community to wrap around these families, and that's what they're experiencing through Family Keys. So not only is that all good goosebump-filled stuff, but the money also talks, which is great. So this slide talks about how much money we spent on the Family Keys strategy in 2023 and 2024. And the next slide talks about really that cost-to-benefit analysis. So understanding how much money we spent is important, but really understanding what those dollars mean, as we sort of teed off earlier with the budget discussion, not every dollar is really a dollar. So what does that look like? So as you can see in the middle green box here, that dollar amount rolled up is just shy of $235,000 is what we spent on Family Keys to keep those 21 families, 53 children out of care or reunified. If those children would have been placed in out-of-home care, we would have spent $491,239 for those children to be in foster care. So that means this strategy, if the county had paid for Family Keys over the last few years, would have saved out-of-home care, and really did save out-of-home care dollars of $256,000 in 2 years. So what does that mean going forward? I think Administrator Leonard shared just before we started that the intention is to look at this strategy moving forward as a strategy to prevent out-of-home care, utilizing our current funds to do that. We are not intending to ask for any additional funds to maintain the strategy of Family Keys moving forward, just the ability to utilize the dollars we already have flexibly to save tax levy and to save cycles of children being placed in out-of-home care and what else that means. And then the last slide on here are the additional videos that we did. If you want a real tearjerker, I recommend Momentum. Have your Kleenex box ready for you. They do have some similarities between the films. They are not meant for one audience to watch all sort of in a row. They're really not meant for all audiences necessarily. So there is, if you watch all three of them, there's some sort of duplication of the message. But they're all great films, and we're really proud of the work of those films, and more so proud and thankful of this board for supporting Family Keys, for our staff, for the work that they've done, and for the families who have invested. This is work to be involved in this program, and they really have worked, and they have been the most important component of this successful strategy.
Any questions for Krista Jensen?
Oh, just thank you for your work you do.
So on the videos part, if you want to watch those, your last meeting, the hyperlinks worked. So if you go to your packet for your meeting last month, those hyperlinks were working, and this one they weren't. But yeah, Krista, again, her and her team did a great job. But just again to highlight the how we plan on moving forward with the budget is really, this is a strategy, I think, is the best way to frame it. We've called it, it's a Family Keys program, and it, words matter, but it's not something that, we did stuff similar to this historically. This is a more targeted approach, a more targeted strategy. Perfect use of, I have to commend the state. Great way to use funding for a pilot. And I think the county has done similar things with pilots. Let's try a new strategy, see how it pencils out in terms of funding. Youth Opportunity Center is a great example of that. Taking our intensive supervision services in-house is a great example of how we're doing that internally. But this was, we were one of 3 counties. Again, just background, one of 3 counties in the state. You saw one of the director from La Crosse talking about their program where they had the nonprofit purchase the home. So thank you to the state as well for giving us the funds to try it and demonstrate that actually for us it's going to end up saving tax levy funds as well.
And there will be a state report that should be out by the end of the month, talking about all 3 of the counties and their program outcomes. So we'll be sure to make sure that we share that information with you as well.
Thank you, Krista. I know that the board was on the fence for a long time on this Family Keys, and it's just so exciting to see that the success and the savings. Of course, we're going into budget. Savings is real important. So with that, do we have the funding to carry this on for another year? Or do we need to get a grant?
You can answer that.
The approach will be to utilize the current out-of-home care funding to support this strategy. So I think if you'll recall, last year we decreased our out-of-home care tax levy request by, I think, 18 children. We won't anticipate to decrease it this year, knowing that we would utilize those funds to make sure that those children still don't come into out-of-home care. But we would not need to request an increase or any additional funds.
And the only other thing I'll say is, not to, I know we'll have conversations at HR Finance. Chair Robinson is going to give a presentation on the state budget, but if you were following the state budget process very, very closely, thankfully, we've talked about in our county budget that we haven't had to have any youth placed, any juveniles placed in correctional care, so Lincoln Hills. You'll recall in the last year's budget, my presentation, I talked about the fee increased through the Department of Corrections by 81%, up to $1,258 in 2025. It was anticipated to go up another 80, it was going to go up to 1,500, well, actually 2,500, so almost double, and yielding the veto pen that the governor has. He crossed off the number 2 when he reviewed the state budget. So the cost for correctional care, should we be in the unfortunate circumstance, but perhaps necessary, if placements are determined by courts, not determined by budgets. If we do need to place a child in Lincoln Hills based on their conduct, the cost now, as of today, well, actually it was earlier this week with the signing of the budget, actually decreased from $1,258 to $501 a day. Still expensive, but a far cry from the $2,501 that it was going to be. So I think we're feeling very good about the strategy we've employed locally with respect to out-of-home care budgeting. And you'll recall the county board recently, as part of your last budget, you adopted the creation of an out-of-home care reserve fund, so that should we have a year where perhaps we don't utilize all of those funds are segregated and assigned for that specific purpose. $400,000 was the limit you set on that non-lapsing contingent rollover account. So I think we have a number of strategies where I'm confident, like Krista referenced, that I don't think we're going to need to be looking at additional levy to utilize this strategy moving forward. That said, I do think there are opportunities, continued opportunities for the community to support the program, as was referenced in the video. This is one of those areas where it does pull at the heartstrings, and it's a great way for local organizations to get involved and support families that there are friends, family members, and neighbors. It's a lot of people, that 53 kids in just a short couple of years that have gone through the program. So I'm sure we'll have all those opportunities for alignment with existing nonprofits and other groups, but short answer to your question, I don't think we shouldn't need new levy.
We do have an existing request out for a grant from the United Way that we are waiting to hear back on, specifically for Family Keys.
Okay, thank you. Chantel?
I wanted to know if you had any idea about expanding, if you had any place to expand, or if you're looking for more rental, like landlords, or if you have enough that you feel like next year you'll definitely be able to serve this many and maybe more. I don't know how that crosses over with the homeless population. I don't normally see a lot of homeless children, but I don't think you see them, because
Well, they shouldn't be. We shouldn't have homeless children because we should be involved if that's the case, utilizing Family Key strategy. I think that we will meet the need, right? And so I wouldn't say we're really hoping to expand in next year to serve 60 children because we hope to meet the need where it is. I think maintaining the vision that Family Keys really is focused on housing instability and that we're making sure the right families are coming through, that they're not actively using substances, that their mental health isn't actively under control is very important, right? And so we could serve probably a lot more children, but not making sure that that safety component still exists, right? Which is going to be the most important thing for us always. Having landlords, additional landlords who are willing to support and be involved with families who are involved through child welfare. Yes, we're always looking to expand sort of our network of those who we could tap into. Knocking on wood, we have had very good luck being able to get our families into housing within 30 days. That's always our goal from time of referral, that they would be in housing within 30 days. We've only had one family we've not been able to meet that need for. So while housing is a barrier because of the relationships that our case management partner, NCAP, has, we've been very successful in getting families housed quickly and appropriately. But expanding that network is very important always for us because they're not just through Family Keys, right? That's not the only strategy. We want them to understand that these are families that we're hoping they would take a chance on either way.
And just one thing, one group we didn't give a whole lot of credit to, we talked about the county board, but the discussion that you alluded to, Madam Chair, about the county board and some of the questions they asked about Family Keys, that program dramatically changed based on those conversations. And quite honestly, I think for the better. Initially that program was talked about kind of a congregate housing approach. And based on some of the discussion, we initiated that work with North Central Community Action Program to really link families with existing landlords. And now the vision for the program isn't that, hey, get out of this house, you're out of Family Keys. It's transitioning them to that same, they take the lease over essentially, which is a far better approach in my mind. I think we really benefited from that discussion.
Able to find them housing where their children might already go to school, they're employed, where transportation doesn't become a barrier, access to services that their family needs.
Yeah, so overall, I think, again, that was a great example of policymaking body articulating, hey, there's interest in doing this. Staff brought back an idea. We got feedback, very clear, which was good. Then we tweaked the program and the county board adopted it through the budget process. And I think it's worked very, very well. Again, I know I'm partial, but I think our approach is the most sustainable of the three counties, and I think we've had really good outcomes.
And excitingly, the Imagination Factory, which is a child welfare reform, reached out recently to ask about our Family Keys strategy and our handbook because they are looking at bringing that forward as a possibility for continued expansion. So you're not wrong. You're not only partial. Just kidding.
Well, thank you. Any other questions? All right, thank you,
Thank
Krista. All right, moving on. Number 7, next meeting, date and time, announcements, and future agenda items. A, committee members are asked to bring ideas for future discussion. And B, next meeting is Wednesday, August 6th at 3 p.m.
Madam Chair, sorry,
Yes.
I don't want to get in the way of adjournment, but there was a question earlier relative to the fees for the health department, and we powwowed since the question. The confusing piece on that is that the title for that column, it should have the increase. What page is that on? Retail food right here. So on page 8, the 2024 rate in fee was the full rate. The 2025 column is the county increase, and the next column is the state increase. The total is on the far right. So it isn't a cut. We didn't go from 378 down to 11. It was $378.30 up to 402. So sorry for the confusion. We'll work on the titling. We'll correct that this year. But just wanted to clarify that.
Can you guys hear me at all?
Yes, we can, Chair Boots.
Oh, thank you. Just something real quick. Two things, I guess. Number one, I was involved in a meeting yesterday for the big, beautiful budget, or bill, I mean. And the things we're going to have to talk at the next meeting, just so you get it on there, Lance, is both CHIPS and then Medicaid, and how it's affecting, and how it's going to affect the counties. So just one thing we're going to have to look at, I guess. Like I said, I was watching a long meeting through NACO yesterday. So if people want to look at it, go on the NACO website to get a kind of a fresh look at what they have coming down the pipe. And then second of all, with Chantel Foote, if you could give her my number, Lance, so she give me a call. Some questions from both the North Central Healthcare Board. So if she could give me a call after the meeting just to set up something with one of our other supervisors.
Will do.
Thank you.
Okay, thank you. So we're moving on to 8, adjournment. What are your wishes? Oh, backtrack again. All right.
I can, we put together for the HR Finance Committee a summary of the WCA analysis of the state budget, NACO's analysis, and the governor's budget message. I've shared that with Administrator Leonard. Perhaps if you could share that with the committee, it'll give you a high-level overview, some of it just specific to the counties and others which is specific to the budget.
Okay. Now, can we move on to adjournment? Okay, Chantel, she moves.
Second.
Ron seconds. All right, any questions? All in favor? Aye. Opposed? We are adjourned. Thank you.